Okay, so we have a few more answers here. Melanie is 4 months after C birth. Stephanie, C-section 2 years ago. By the way, I use the term cesarean birth. And before I start my talk, I just want to give a little reason why I use the term cesarean birth. Cesarean birth is a term that was described to me only a few months ago as I started talking more about cesarean birth recovery and therapy. I said C-section all along, and it was brought to my attention that the term cesarean birth is more active, meaning it is more active in the mother's experience. When a C-section happens, I mean, a surgery happens to you, right? So a C-section does not, that term, that language does not really say anything about your involvement in that birthing process of bringing that child into this world. But the term cesarean birth puts it on that level playing field of vaginal birth. You know, we give birth vaginally. Well, we also give birth surgically as well. And that is not lesser than. That experience is not unnatural versus unnatural vaginal birth. So I use the term cesarean birth because I think it's a much more empowering term. I think it also gives that ownership, that experience back to that birth mother, that birth parent, right? She gave birth. She, someone didn't deliver her baby for her. So when I say C birth or cesarean birth, I mean C-section. All right. Okay, so let's get started. I want to start today's talk with a story. Betty, I see that you're entering in. Sorry, I just wanted to know a quick if I need you to chat with me about anything first before I can get started. I'm just looking for you to write something in the chat if I need to stop and wait for you. Okay, great. So I'm going to get started. I'm going to start today's talk with a story. And this story is about one of my patients, one of my proactive moms called Candace. So it's 5 days after Candace has had her cesarean birth. And it's 2 a.m. and everyone is asleep. The baby is in her bassinet right next to the bed where Candace and her partner are sleeping. And then suddenly the baby wakes up and starts to cry. She starts to fuss. She's hungry. Instinctively, Candace gets up to tend to her baby, but she's stopped short by a searing pain in her abdominals. And it's so painful that she drops back into the bed and she's short of breath. Literally, it's taking everything out of her to try to get herself back into a sitting position so she can get to her baby fast enough so that her cries wouldn't wake the rest of the household. And she finally gets to her new baby girl and she cradles the baby in her arms and consoles her. Candace can't hold back her own tears of frustration. When the hell is this pain going to stop? When is my body going to be normal again? Because this can't keep happening. This story about Candace is a mom that I see often in my practice. My name is Jeannette, and I am a perinatal therapist. Candaces in my community and my world come and see me because there is a situation, we'll call it childbirth, that has happened that is causing acute pain that needs to go away. My job as a perinatal therapist is to take Candace from that moment of injury, rehabilitate her back into pain-free activity, living, and sport performance. So here's the big question then, right? How do we get from where Candace is to pain-free living? So for the next 25 minutes, here's what I want to do. I want to tell you 3 things about cesarean birth that you have probably never heard about. And I want to also warn you that these things I'm going to talk about, may provoke you a little bit. It may agitate you a little bit. And that is my goal, because I want you to understand that there are other options outside of what you may currently believe to be true. All right. So when you leave today, I want you to, that take home message will be, I want you to know how you can optimize your own cesarean birth recovery. Okay. So there is you are absolutely able to do a lot of this yourself. Okay. After that story, just quickly jot into the chat here. Does anybody relate to the story? Do you find that story relatable? Was that you? Is that something that is still fresh in your experience? Just write a yes or I hear you in that chat, and then let's begin. Okay, so sharing. Here it is. Okay, here's the first thing I want to tell you about that may be a little provocative. What is a cesarean birth? My answer to that is a cesarean birth is major abdominal surgery. It's surgery. Sure, it's a way that your baby has come into this world, but you have experienced major abdominal surgery. So I just want to show you for a second what that major abdominal surgery looks like, okay? So here's the surgeon's scalpel, all right? If you don't know what has happened to your actual body during the surgery, I'm about to show you. There are 3 incisions that are actually made during a cesarean birth. The first one is here. By the way, I'll just draw this on my belly at this level because it's just easier for everybody to see. Obviously, a C birth incision is much lower and closer to the pubic bone. But the first incision that the surgeon makes is here. It's a horizontal incision below the umbilicus, through your skin and your fat layer, and it stops at your muscle layer. Your muscle layer is then separately incised with a vertical incision right down the center of your linea alba, which is a tendon that separates the left and the right side of your six-pack. Okay? By the way, that vertical incision is made by the surgeon's finger, not by a scalpel. And the reason why is because that tendon has been stretched so thin that it just kind of separates. Okay, so the integrity it's so delicate at that point at the end of pregnancy. Then there's a third incision, also horizontal, on the uterus itself. And then you birth your baby. After the baby is born, there are stitches that sew up your uterine wall. The vertical incision, however, is left entirely with no stitches. They used to stitch it, but not anymore. They just found it heals kind of just the same. So there's no stitches that hold your six-pack together after your cesarean birth. And then there are sutures that hold together the external, usually horizontal incision. So when people talk about cesarean births, oftentimes they think about their external incision because that's what they see. But don't forget, there's 2 more deep inside. Okay, so here's what I want to do. I want to show you a photograph of a live cesarean surgery. But here's a warning. This is graphic. So if you're a little queasy, just look away and I'll tell you when I change the slide. Okay, so it's a photograph of live cesarean birth. On that left-hand side, you may have probably seen pictures common to this, right? So there's a baby and the baby is being born. There's the umbilical cord still attached to the baby and the umbilical cord is going into, well, the patient's abdomen. The right-hand side is a close-up. I need you to appreciate the trauma that your body has experienced. A lot of you are talking about, a C birth that are a few months and maybe even a few years out. But understand, everybody, that this is major abdominal surgery. This is what has traumatized your tissues right down to the insides of one of your organs. Okay, the slide has changed. Everybody can look back if for those who were a little queasy about graphic photographs. So that I wanted to share that photograph with you because I needed you to understand that treatment is necessary after cesarean birth, right? Getting therapy and rehabilitation for weeks and months after cesarean birth is necessary. And even years after, right? Especially for those of you who may not have considered rehabilitation after cesarean birth. And I always say that, a C birth requires the same rehabilitation as a knee surgery or any other type of major surgery. And as a matter of fact, I mean, for anyone who's gone through a musculoskeletal surgery, ACL surgery, whatever, if someone in your family has had hip replacement or anything like that, they knew when their surgery was. They knew what the rehabilitation protocol was. They had their icing machines rented and set up way ahead of time. They had their support networks all figured out. They had, their rehab protocol set up week to week, knowing what milestones they had to hit for the next 8 months. Everyone, this is what is necessary after a cesarean birth. It is no different, and it requires the same kind of, it is a right to rehabilitate just as well. It is not a privilege, it is a right. Okay, so the next thing I want to say that may be a little bit provocative is this. Pain is not normal. Ever. Pain is not normal ever. And I just want you to kind of reframe what pain can be. Pain, I like to say, is just your body's way of telling you that something isn't right? Pain is your body's language, right? It doesn't speak English or another language that you may speak. It speaks pain. So it could speak pain quietly, but if you choose to ignore its messages, it'll start to speak pain a little louder and a little louder and louder still until you can't hear anything else other than what your body is trying to tell you. I don't want you to get to that loudness of pain. I want you to hear that pain, and I want you to know what to do to address your body's needs right from the get-go. What causes pain after cesarean birth? Well, without getting right down into the physiology of everything, let's just simplify it and say, well, pain is being caused by tight scar tissue, number one. And number two, it's being caused by tight abdominal adhesions from your incision, right? From all three of your incisions, but definitely notably on that external incision, on that vertical incision, and just deeper to those levels. All right. So when I'm talking about scar tissue and abdominal adhesions, they're actually not the same things. So for all you see birth mamas 0 to 6 months postpartum, you can still affect that tight scar tissue. For anyone past 6 months postpartum, your goals are going to be to address the abdominal adhesions. And what's an abdominal adhesion? An adhesion is anything that sticks something to something else. So in this case, it's sticking something to something else that it shouldn't be stuck to. And so fascial work, fascial treatment can address abdominal adhesions. This picture, these two pictures, by the way, are very interesting. They were one of my students in my cesarean birth self-care course so kindly shared this with me because she had a very good example of what a tight scar tissue looks like. So this is her 3 months post cesarean birth surgery. So from the front view, can you see just underneath her abdominals how her incision is tight? So it actually tucks right under, or makes her abdominals look like it's bulging forwards, and the incision is tight and creates that shelf. It indents right above her pubic hair. And from that side view on that right-hand picture, you could see her abdominals are not flush with the incision and vice versa. Okay, so that's what I mean by tight scar tissue. So there is an aesthetic effect as well as pain. So what can tight scar tissue and abdominal adhesions cause? So here's what the research is showing. The research is showing that adhesions cause chronic abdominal pain, causes chronic pelvic floor dysfunction. And for those of you who are not familiar with what the pelvic floor is supposed to do, well, it holds up your insides, right? It allows certain things to come out, like urine and fecal matter. It also makes sure that those things don't come out if you don't want it to. Pelvic floor allows things to come in, such as during sex. So my third point here is adhesions can cause painful sex. Your abdominal adhesion from your cesarean birth surgery can cause painful sex. It's all connected. All that tissue is connected. Okay? What else can these adhesions cause? It can cause postural changes. So what does that mean? When you don't have something that's tight in the front of your body and bending you forwards all the time, you would otherwise be able to stand up straight or sit up straight. But sometimes those adhesions are so intense that you can't stand up straight or sit up straight. So what does that do to your body? Well, as you move over the months and the years and your movements are incorrect, you have an increased risk of injury. What else is the research telling us? So I don't treat these directly in my practice, but did you know that your cesarean birth can affect your digestive system, right? It can actually cause constipation or the opposite. And the research is also showing, and I thought this was very interesting, it links to fertility or infertility issues because of the adhesions can bind down the function of the reproductive system itself. Okay, so what can we do about this? If we are experiencing any of those things on that list, and if you're experiencing pain in general, let's just talk about pain for a second, because as a therapist, this is, it's why people see me, they have pain. So especially with a cesarean birth, I think you all already know this, but I want to say explicitly that the psychology of healing and the psychology of pain is so much more of a thing that you will have to address than someone who hasn't gone through a cesarean birth. And as a therapist and as someone who has seen a lot of C-birth mamas and also vaginal birth mamas, cesarean births are an experience in and of itself. There are oftentimes a cesarean birth that did not happen because it was planned, and there are negative emotions related to that experience. The cesarean birth and its impact on a mom's body can also be unexpected and can lead to negative emotions. Do you know what I'm saying? There's a psychology, a very strong mental link to a cesarean birth that is unique to that cesarean birth and doesn't exist with a vaginal birth. And of course, there's all the societal messaging about how, oh, a cesarean birth is unnatural, or it's the easy way out, and all these other kinds of messaging that can shame a mother for having a cesarean birth. So one thing I need you to understand about your cesarean birth, and I don't care if you're 1 day postpartum or you're 10 years postpartum, the psychology of pain is something you want to very consciously address. This is the first thing I talk about when I work with a cesarean birth mother. Pain is increased with anger and fear. So here's the first thing I want all of you to try. Let's all do this together. I want you to look at your incision. Okay, pull up your shirt. I want you to look at your incision. And for those of you who have never looked at your own incision before or touched it before, I invite you to be as brave as you can be at this point. I'm going to ask you, what are your thoughts? Don't type them down. Keep this to yourself. What are your thoughts? What is the first thing that comes to mind when you're looking at your incision? And then I want you to remember that statement or those statements and feelings. Are they observational statements or are they judgmental statements? What's the difference? Observational statement is, my incision is dipped on the right-hand side. Another example is, my incision is tight and lips inwards and is not flush with the rest of my abdominals. A judgment statement is, my incision is so ugly, there's no way I'm ever going to show this in a bikini. Another judgment statement is, I hate this thing. I wish it wasn't here. What you think and how you relate to cesarean birth influences how you recover from your cesarean birth. physically, and I'm talking physically. I'm a physical therapist, and I still have to ensure that your relationship with your incision is such that it is conducive to healing. So that's just an exercise I want you to try to keep in the back of your mind, especially if your first thoughts were more of the judgmental thought versus an observational thought. I challenge you to change your thoughts to them becoming more observational. The next exercise I invite us all to try together is this. Erase the marker. And just going through the chats a little earlier, I didn't see anybody who was newly postpartum. So erase the marker is an appropriate technique for anyone who has had clearance from their obstetrician, usually that's 6 weeks postpartum, but also has given it a bit of healing. Okay, so erase the marker might be appropriate at 8 weeks postpartum. And for those of you who are months and years postpartum, if you've never done this technique, let's try this together. The ideal positioning for this technique is lying on your back. Okay, this is a self-massage technique. So if you're lying on your back, you want to put your fingertips on the actual incision, drag the actual incision and skin in circles one way and in circles the other way. It's called erase the marker because if your incision was actually drawn with a water, what's it called? A washable marker, it's as if you were erasing that washable marker. All right. So let's just do it the live version. So for those of you who want to see it live, let's try this together. Take your finger and just gently erase that washable marker. Couple of things you're doing at this time. You want to assess your pain level. Again, it doesn't matter if you're 8 weeks postpartum or many, many months postpartum. If you've never done this before, you want to be aware of what this feels like. First, what is your pain? If 0 is no pain and 10 is the worst pain you experienced after your C-birth on your incision, I want you to be a 2 out of 10 at the very most. So you'll probably feel nothing more than a stretch. And when I say stretch of your fascia, I mean this. Like if you grabbed your forearm and you twisted it, that is fascial stretching. Okay, that is what will happen if you took the skin and you really made big circles. But if you made small circles, that's what you're experiencing as fascial pull. It's just superficial. And what you're also feeling for is a difference between the right side of your incision compared to this section of your incision, compared to this section of your incision, right? So you're comparing your whole incision to itself. And then you're going to go in the opposite circle. And then you're also going to compare to a part of your body that has not had an incision to know what this is supposed to feel like, right? Compare it to your own tissue. There's an incision here, it's probably restricted. There's no incision here, it's not restricted. So if this is your first time doing a C-birth massage, start with very small circles. But if you've done this before, don't be afraid to really drag it. And especially for those of you who are months postpartum, out to 6 months postpartum, you can really, really push it. And for those of you who are after 6 months postpartum, this next point is for you. I'm hopping over to my slideshow. This last post may provoke you because I'm going to tell you something. There is a finite window where massage of your incisional scar tissue is optimal. And that window is 0 to 6 months post cesarean birth. This is based strictly on research on how fast tissue heals. I've also capitalized the word scar tissue because remember, you have 2 things that you're treating when you're doing self-massage. One is the scar tissue that holds the incision together, right? The glue that actually sticks that incision closed. And the other thing are abdominal adhesions that are created by adhesions, which are thick fibrous bands, and that's what you can still treat via fascial therapy technique. So still self-massage, right? But you're treating something different. You're no longer treating that scar tissue. And treating the fascia, you can do that months and years postpartum, okay? So don't think, oh my gosh, it's too late for me. If you're past 6 months postpartum, it's too late for your scar tissue, but it's not too late for your fascia, okay? But for those of you who are within that 0 to 6 months postpartum window, you want to get that scar tissue moving, right? Think of aesthetically. Remember going back those few slides of that mom's abdominals? She had that scar tissue so tight that it was not flush with the rest of her abdominals. It dimpled right in and created a shelf, right? That's what I'm talking about with scar tissue that's too tight. You can still affect that 0 to 6 months post C-birth, and you want to. So what would I say to Candace, our hero in the story at the beginning of this talk? Well, I say a lot of things to Candace and all the Candaces that I see, and it challenges Candace's current view of the world. Because the first thing I tell her is this: don't rely on public health care for post-cesarean birth recovery. If you continue to hope that your public healthcare system is going to optimally rehabilitate your scars and get you from pain to pain-free activity and back to sport performance, you are wrong. That's not what public healthcare is for. That's what you are for. What I mean is you need to do the work yourself. You're going to need to find your perinatal therapist. And if you cannot find a perinatal therapist, you're going to access the information everywhere that is available to you for healthcare that is going to empower you to do your own rehabilitation, to see the people who will help you with your rehabilitation. Okay? Again, public healthcare, your obstetrician, that's not their job. Their job isn't to rehabilitate you. So I understand you may have anger and frustrations around that, and I absolutely want to say, yep, that's a thing, and yep, that is your reality, and I perfectly understand that. And now let's move past that. Let's say that you will now seek out a perinatal therapist to help you with this. And the last thing I would say to all the Candaces in this world is, I want you to learn self-massage. Because even if you can access a perinatal therapist, you're not going to be able to see them every single day, right? Or even 3 times a week for a long while. That is why you must empower yourself and learn the techniques. So at this point, I want you all to hop over, grab your phone, hop over to your Instagram, and follow me at Ask Jeannette. There is a ton of information there and a ton of resources there about your cesarean birth recovery. So if you don't have a perinatal therapist, start there, please. Ask me questions, DM me. There is so much we can learn through social media these days that are based on fact and will be helpful. And then I really want you to download in my profile 10 things you need to know about your cesarean birth, because that will cover a lot more information that hasn't been covered in this talk, that will start more conversations and help you ask better questions so you can get better answers. Lastly, I want you to come to my booth. I have a booth at MomFest for today and tomorrow, because I do have exclusive offers just for MomFest. And what that means is for my cesarean birth online course, I run this course every 6 to 8 weeks, by the way. I teach a live course for moms. It's 4 weeks long that helps them recover from the cesarean birth, teaches them how to do all the different techniques of self-massage. So I want you to hop over to my booth for more information about that. So to all the Candaces in this world, I want you to know that you are not alone, and your recovery absolutely can continue to happen even years after you've given cesarean birth. Okay? So at this point, I just want to say thank you very much for joining me. I'm not leaving here, but I do want to say thank you for joining me for this talk, and I hope that it was informative. All right, so I'm going to stay and answer a ton of these questions I'm just going to scroll back to the beginning here. Absolutely, we can stay, by the way, as long as we want to in this particular room. And please, if you can't catch me here, join me in my booth by the same name, Jeannette Yee, and it'll be perinatal therapy. And I'm doing mini assessments over there as well. Okay, so what do we have here? We have cesarean birth, 20 months, 1 year, 4 months, 2 months, 4 months, 2 years. Okay. 3 weeks ago, Megan had a C birth 3 weeks ago with a complication. Oh, Megan, I'm sorry that happened. That's a lot to deal with. Okay. Let's see. So comments about the photograph, comments. Okay, so comments about how long it took for people to end up actually taking a look at their C birth. I find that that's you're not alone. I need you to understand you are not alone. Ugh. Again, there is um, a psychological experience with a C birth that is honestly it's not addressed enough, and it needs to be. And I'm really glad that you actually, Elena, you got to the point where you're able to look at your C birth. 7 months post C birth. 4 weeks ago, Tara had a C birth 4 weeks ago with a third baby. Congratulations. It's not looking at it that an issue, it's with touching, says Caitlin. Okay. And she's pregnant right now too. Caitlin, let's talk about this a little later. So let's see. We have a couple of questions. I do have people waiting in line here. So if you don't mind, I'm going to take the people who are in line who are brave to hop on the video with me. Rhonda, if you're still here, I'm going to ask you to come on with me. And let's see if she's still here. I'm not sure she is. Maybe she's hopped away. Hazira, I see that you're here as well. Let me see if you can hop on. And not sure that worked. Okay, maybe those individuals are not here anymore. Okay. Laura Severino asks, how long do you recommend self-massage in the first 6 months? Great question, Laura. I recommend self-massage or some kind. So here's the thing. It's self-massage and it's movements or exercises. You want to do the both. And so I always describe to my athletes, you want to lengthen before you strengthen. Lengthening meaning massage, strengthening meaning exercise. So with that in mind, Laura, I always recommend something every day in the first 6 months. And that something can be 1 minute long out of your day. Or it can be 10 minutes long in the case of a more involved self-massage, but daily. If you think about rehabilitation, the more you can address that injury slowly and progressively, the faster it heals. All right, Cassandra asked, so will I have a shelf forever? I'm outside the 0 to 6 month range. Fantastic question. And for anyone who's joining and wondering what the shelf is, I shared a picture, actually let's share it again, about a tight incision. So a tight incision looks like this. Tight scar tissue, sorry, it looks like this. Tight scar tissue creates an illusion of a shelf because the incision is indented into the abdominal tissue where the abdominals are no longer flush to the rest of the body. So will you have a shelf forever? No, because a lot of different things lend to a shelf, right? Abdominal incisional tightness is just a part of it. Fascial restrictions, which you can absolutely address post 6 months, is something else you can do. And then there's so many other things as well. What's your current exercise like? Is there a strengthening protocol that we have to talk about? What's your alignment like? Maybe if you're a little sway back or you're weaker in the abdominals, it'll look like it's more splayed when if you stood with proper spinal alignment, then it would not be, and it minimizes that shelf, and so on and so forth. But great question, Cassandra. Stephanie asks, numbness and tingling are frequent. Yes, numbness and tingling, by the way, surgeons report that it'll take up to a year sometimes for sensation to come back 100%. And there is a small population where that that sensation does not. And it's always varied, different parts of the incision, above or below. Caitlin asks, what can be expected for healing with a second C birth? Oh, this is such a awesome question, because did you know a cesarean birth surgery is the only type of surgery that I know that has been explained to me by obstetricians, where it is desirable for the surgeon to cut right along an existing surgical line. Incisions, scar tissue holds together the incision, and scar tissue in your body is nothing tissue, meaning it's not a muscle, it's not skin, it's not an organ, it's not a ligament, it's just a bunch of glue. So when you cut a bunch of glue and you want it to glue back together, it doesn't do that as well as then if you cut healthy tissue and get healthy tissue to stick back together. Caitlin, that might not be your exact question, but that is kind of a precursor to explain to you. With a second cesarean birth, then recovery is a little more challenging because of that, right? So now you've got scar tissue trying to grow on top of scar tissue, and scar tissue is already sticky, so it's just going to stick a little bit more. It doesn't mean that you can't recover better. It just means it's going to be a little more challenging than the first time around in terms of a tissue healing perspective. I'm not talking about your how much pain you're experiencing, etc., because you'll probably still have pain, but the expectations you will have more realistic, which also helps to mitigate the pain. So understand that once a person has had two cesarean births, subsequent pregnancies are most likely going to be cesarean births as well. Another question, is there anything I can do to prepare for a quicker recovery and also scar tissue? Yes, yes, you can. Oh my gosh, great question. So quicker recovery comes, and it doesn't matter what kind of surgery you go into or what kind of injury you have. Everybody who's listening, the stronger you go into surgery, the faster you recover. Period. Doesn't matter what surgery it is, okay? So in this case, you're asking about a C birth. Yeah, so the stronger you go into your C birth, the faster you will recover. So it sounds like you are pregnant with your second, Caitlin. And if you are, get strong, right? Congratulations, Caitlin. Get strong, right? Like do commit to going for a walk every single day if you can. Commit to movement every single day, even for a short period of time. And I know because this is your second, it means you have a first, which means you're chasing the first around. So you are active. You are active. When I talk about committing yourself to movement, that's part of it. I also want you to commit to abdominal strength and patterning during pregnancy, as well as hip strengthening, big time. And if you have specific questions on what you should be doing, absolutely hop into my booth and we can talk a little bit more specifically about that, because I can bring you on the screen and show you. So I missed your, I get tons of cardio in these days. That's amazing, Caitlin. Good for you. Good for you. So, I mean, you know, as a perinatal therapist, we talk about the journey of like how we recover from cesarean birth. The recovery starts before the cesarean birth, right? You go into your surgery strong, you come out faster and stronger. And then also having a guided plan postpartum and knowing what that plan is before you go and have your C birth, I find helps a lot, because there's so many unpredictable variables after you give birth, especially if it's your second child. You got a first kid who wants to hang with you and you can't, and you got a second kid and you've got, you know, only yourself and your partner because it's, you know, a pandemic, and you kind of want a game plan postpartum in place that you can follow. So that's what a perinatal therapist can do for you. All right, everybody. So I'm just going to invite everybody to hop on over to my booth. By the way, in my booth, I have a ton of promos and support resources I want all of you to come and take a look at. And my booth, I think, is just Jeannette Yee, perinatal therapist, and you would look for that in the marketplace. So I'm just typing this in. The marketplace, you'll find on the left-hand side icons at the bottom. Okay, so why don't we all meet there if you are interested? There are a lot of other super fantastic vendors and talks that are going on. So absolutely take a look at them there. I will be here until the end of the day, which is 4 o'clock. So please do hop on in at any time. If you feel more comfortable sending me a private message, you can do so by clicking on my name, and then you can send me an actual message there, especially if you don't want to chat where everybody else can see, or hop onto a video screen where everybody can see. But honestly, the easiest way is just to add me on your Instagram, Ask Jeannette Instagram, because I'm very active and then I engage a lot on that platform. So you can always direct message me there. All right. So thank you so much, Stephanie. You're welcome. And I hope to see you all at my booth.